there are 420 million people living with diabetes, and it's quadrupled since 1980.
We all know someone with diabetes, or we all will know someone with diabetes. Maybe a person with diabetes in your life doesn't feel comfortable talking about it because of the stigma and shame surrounding it.
Data from OECD, data from WHO really shows that there is a substantial increase in the number of patients that we are seeing with diabetes.
Now that we are here 100 years after the discovery of insulin, I think that the global community is really recognizing that there's still so far to go.
You still have people who can't afford it. You still have places that say we can't store insulin because we don't have a cold chain system.
In 2021, it's predicted that 235 million people globally will need humanitarian assistance, and it's particularly challenging for people living with diabetes.
The Global Diabetes Compact is a golden opportunity to come together and focus on how to support people already living with diabetes, but also to prevent people from getting type 2 diabetes. It's a journey that is just started. And I think that's a really good thing, because that means that everybody can come on board and give their advice.
As a person with diabetes, it feels great to be connected with others around the globe who are going through a lot of the same issues that I experience.
If you look at HIV, this was really part of the success, the game changer, that people living with HIV started to be very vocal on what kind of solutions they need.
In rural Zimbabwe, a person cannot be diagnosed in a primary healthcare facility because we don't have the resources, we don't have the people who can do that. So this compact is aiming at that, training people at the root.
I think that the root of diabetes care should really come from primary care physicians, because that's who you'll most likely see. Primary care physicians should be trained to be supportive of their patients' mental well-being as they either adjust to life with diabetes or as they go through whatever types of things that life throws at them that may impact their diabetes management.
Bringing diabetes into primary care is essential. The earlier we can start to treat these patients and minimize the impact that diabetes can have in the vascular system, the better results we can have.
Insulin has been around for 100 years, but we have 3 major companies that are dominating the market.
The greatest opportunities for increasing access to insulin, particularly in low and middle income countries, is really better access to greater competition in the form of biosimilar insulin. There's a number of barriers currently preventing that from a systemic perspective, but we really think the Global Diabetes Compact provides us the opportunity to engage with the private and the public sector on what exactly are those barriers to reduce the time and cost associated with bringing these biosimilar products to market.
Maybe with the compact, we'll have more manufacturers of insulin, better pricing of insulin, price caps. We need all those things.
What I really hope with the compact is that we think about the most vulnerable and the most challenging circumstances. If we can address the needs in humanitarian settings, in low resource settings, firstly, we're helping those who are most vulnerable and most in need. And secondly, the lessons learned and the solutions found for those areas can probably be useful for people living with diabetes everywhere.
I am so passionate about trying to break down the barriers to ensure that the health systems that we work with today are built to sustainably provide the access that people need in years to come.
I commend Dr. Tedros, our Director General, that he really picked up on this idea and supports it. I want to focus on solutions, and I can see that all the people who are interested in joining the Compact has the same idea.
The next 5 years could bring so much positivity in the diabetes world.